patient's problem. To assess the patient's problems and address any questions or concerns raised by her. Okay. Hi, good morning, Mrs. Jessica Driver, 66 years old. Am I talking to the right person?
Yes.
Okay. How are you today?
Fine.
Okay. Are you aware that what will be our discussion about today?
A little bit. The GP referred to you because I have some difficulty bringing the food to my food pipe, and that's why I'm here.
Okay, I see. If you permit me, we can start our discussion. And if I ask any personal question that you don't want to answer, then just let me know and stop me there, okay?
Okay.
Okay. Uh, so, Mrs. Jessica Driver, okay, can you tell me what brings you here today and why your GP sent you here today?
I have the problem in my throat, and during some of the month, I have the problem during the eating, and the food. I have to the forcefully push down my food into my the stomach and food particle, and that's why GP referred to you. That's all I want to know about myself.
Okay. That means you are having difficulty in swallowing food.
Yes, yes.
Okay. Where can you tell me specifically that where is the site that is causing discomfort to you?
Exactly, I can't mention, but is I feel there is a stuck over my upper chest and lower neck area.
I see. Okay. Um, how long does it occurring?
It's been 3 months.
Okay. Is it difficulty in swallowing? Can you tell me what kind of food is causing difficulty in your swallowing?
At first, while I having some bread or the burger, I feel that something is stuck over the throat. I need to take the lots of the water to forcefully push it down. But nowadays, I feel that I have to for that I have to take a more soft the food. But right now, I feel that I have also the problem with soft food also.
Okay, I see. Can you tell me that whether it is, what's the nature of its, progression? I mean, is it progressive? No? Do you feeling
Yes, it's getting worse. Yes, it's getting worse.
for how long it is getting worse?
It's been from the first of the time I have the notice, but I think it's getting the worse in the 20 days or last the 1 month.
Okay, I see. I'm really sorry. When there is difficulty in eating food, it really bothers a lot, and it's very important. I can feel you. Okay. Can you tell me anything associated, discomfort do you feel with eating difficulty?
Sorry, I didn't get that. You would like
Okay,
to
I'm
ask
saying,
there is any other? Yes.
yeah, any other discomfort or any other thing you want to mention, anything concerning
No,
you.
specifically no. No, specifically there is no other association with my this the solving of the problem. But
Okay,
occasionally I have to throw up. Occasionally I have to throw up what I have eaten.
throw up. Okay. Does the food come up through the mouth, or it also come some fluids also come up through the nose?
No, just it's just come out of from my mouth.
Okay, I see. And do you feel any kind of, burning sensation or anything do you want to mention
Where burning sensation?
in your chest or lower, throat or in your upper chest?
Yes, I have had it since the long. Um, that's why I'm taking some syrup for that. But right nowadays, it's not increasing. It as before it was.
Okay. Does your GP, aware of this kind of burning sensation, and does he, mentioned you to do something, to do any maneuver to,
I
you know,
haven't visited. No, I haven't visited any the doctor for this reason. I just went to the pharmacy. They take the some medicine. I felt okay with this medicine. I
okay,
haven't any of the bother.
okay, I see. Can you tell me that any other disease condition are you aware of? Do you have any kind of otherwise any kind of disease condition or
I
health
don't
issues?
have no, I don't have any particular the condition, but I have the raise the blood sugar level. Also, my cholesterol level is high. That's why I'm taking some medicine.
Okay. Can you mention that any kind of medicine, name of that medicine?
Uh, GP they gave me some give me some metformin 500 the milligram. The also medicine is called the statin something like that.
Okay, I see. No, do you have any joint pain or any kind of, skin thickening? Do you feel anything kind of like that? Any problem? Do you notice?
I have the joint pain since 6 to the 5 years.
Oh, I see. And anything else you want to mention?
No, no.
Okay. And are you taking any kind of painkiller for this?
Sometimes I have to take the paracetamol, and sometimes I take some ointment over my knee joint. That's all.
Okay, nothing other than that.
No.
Okay, I see. And okay. Okay, I want to ask you some, personal question. I have to ask, most of my patients because those questions will concerning your diagnosis. So, is it okay for you?
Please go on.
Okay. Do you drink?
Yes.
Hey, can you mention the amount?
It's about the 1 or 2 glass of wine.
Okay, 1 or 2 glass of wine, right? Okay.
Yes.
And do you smoke?
Yes.
Okay, can you mention the amount or sticks per day?
Uh, Actually, I really ashamed to say that I'm chain smoker. I have to take like 20 to 25 with the stick every day.
I see. That means you are feeling bad about that, right?
Yes, yes.
Okay, I think that is a very positive thinking. I really appreciate your thinking, and actually, it is really harmful for your health. And we will, if you permit, we will help you to come out of this, of this problem, and we will attach you to a smoking cessation team.
Okay,
Is it
okay,
okay?
okay.
Okay. Fine. And can I ask you that with whom do you live?
With my husband.
Okay. And is he fine?
No, he's the little bit disabled. He can't the work properly without any support.
Okay. Just two of you live alone in a,
Yes, yes, yes.
then,
And I have to take the care of my husband.
oh, I see. Then you have a huge responsibility, I should mention, right?
Yes, yes.
Okay. What about your parents? How are they alive, or if they're alive, then what about their health condition? Are they fine?
Uh, they're yes, they are alive, but they are too elder. They are like at the 80 plus. They have the disease like the heart disease or some of the hyper raised blood sugar the level, also the raised blood to the pressure level, and otherwise they are fine.
Okay, otherwise they are fine, right? Okay. Can you do you want to mention anything else other than your swallowing difficulty?
Uh, my colleague, my friends, they're noticing that I have lost of the weight in during this month.
Okay, I see. Is it intentional or unintentional?
No, it's absolutely unintentional.
Okay, absolutely unintentional. Do you have any, thoughts in your mind that why it could happen?
Actually, I don't have any other idea, but I'm starting to thinking as I have the gastric the problem, the since I'm taking medicine for that for the long. That can be related with this the condition, maybe.
I really appreciate your thoughts. Okay. Can you mention what amount of weight did you lose in how much period?
I think it's about like 8 kg, and during this the 2 months.
Okay, then it's a little bit concerning, right?
Hmm.
Okay. Now, don't worry. Let's see what is ahead. Mm, uh, did your GP told you anything else according, towards your problems or towards your health condition?
No, no, no. He didn't say anything about that. But he assuming that as I'm also becoming the palo the day by day,
Yeah.
so they think is that I have to go to the bowel the doctor to make all the investigation that done that actually the what happened to me. You need to the find out as early as possible. He said that.
Okay. Do you feel weak or breathless, you know, due to in doing ordinary activities? I mean, that as you're saying that your GP mentioned that you were becoming paler. So,
Yes,
and you were, yeah,
yes. Nowadays I feel so weak.
I see. Okay, I really feel you. I'm sorry. What about your siblings? Are they in good health?
Yeah, there.
Okay. Um, I see. And do you have any concern regarding the investigations told by your GP?
I don't have actually right now. I just wanted to know that what actually happened to me, and this is one short of the one short of the cancer.
No, okay. I really appreciate your concern. Are you ready? Do you, if you permit me, and if you, you know, prepared to know the better or the worse of this condition, I will really tell you about that. Is it okay?
Yeah, go on, please.
Okay. At first, I want to do a examination of you, and if you permit me.
Yeah, please keep
Okay.
going.
Okay. I will do. At first, I will inspect you. No, generally, and then maybe a closer look to your abdomen, and then closer look to abdomen, and then I will just palpate you a little bit, and if you feel any kind of pain, then just stop me at that moment, okay?
Okay,
And maybe I will ask you a few more questions, regarding your diagnosis during
okay,
examination. Okay,
okay.
don't worry. Okay. Do you feel any kind of lump and bump in your neck or any other part of your body?
No,
Okay. And what about your bowel habit?
that's normal.
That's normal. Okay. Mm, I mean, you're sure that your bowel habit is normal. I mean,
Yeah,
number of motions and consistency, your stool.
everything is as it's before. Everything was normal. Is normal.
Okay. At first, I will, inspect the patient Sorry,
Okay.
2 seconds.
No problem.
Okay, at first I will inspect the patient and her body build, whether she look, obese or cachectic, and then I will go for, if convenient, I will do the weight measurement at first or at last, and then from the top I wish to see the anemia, the jaundice, and the lymphadenopathy in his cervical region. The most important thing I want to mention, that I want to go for see for Virchow's gland in the left supraclavicular region, and then I will see for clubbing, leukonychia, and leukonychia, koilonychia, and any jaundice, and then I will say for any kind of scar mark, previous surgery, previous scar mark due to previous surgery on her abdomen, and then going to the lower limb, I will see for her legs, for any kind of you know skin change on her both lower limbs, which will concern to Crohn's disease, necrobiosis lipotica or erythema nodosa. And as she mentioned that as she was suffering from joint pain, so I will quickly go for just squeeze her small joints of her wrist and her ankle joints, and then definitely I will inspect the oral cavity for any kind of oral ulcer or oral hygiene, and for angular chelosis and stomatitis and glossitis, and as well as I will definitely okay, this, and then I will take a closer look to the abdomen, and I will take ask that whether there is any pain. If there is any pain, I will start from the furthest point. I will do a superficial palpation, whether any mass, whether I can feel any mass. Then I go for a deep palpation, and I will give us special attention to the, especially to the upper, what should I say, epigastrium, and as well as any kind of organomegaly, especially hepatomegaly. Then to exclude my DD, I will give special attention to the right iliac fossa, though the patient's bowel habit is normal, and then I will go for specific, and in case of elderly patient, there might be a mass lesion in the epigastrium. If I feel any kind of mass, I will go for the side, shape, surface, consistency, and tenderness. Okay, and as well as the age. Okay, and whether it is fixed to the overlying skin or underlying structure, and as well as any kind of surrounding skin change. Okay, and this and oh, and as well as I will notice the, definitely I will notice any kind of skin change in his, I will inspect it during the general examination, or relevant examination. Most of the CS stomach patient have acanthosis nigricans, so I will look for any kind of purplish and dark purplish lesion in on her neck, back of the neck, or any armpit, and I will ask for whether she has any kind of skin change. If she I will don't maybe I will not see for the armpit. I will see for the back of the neck, and she is diabetic, she told me before, so I will definitely ask her that when she last measured her CBG. If it is so long before, then I will ask for to the examiner that I want to examine the bedside CBG. And I don't know whether it is relevant here or not, to see the diabetic complications, and I will definitely see for any kind of skin puckering, Raynaud's on his hand, or any kind of telangiectasia to exclude my DD scleroderma. And okay, and I think, oh, and as her bowel habit is normal, I think I am not sure whether I should ask for parectal examination or not. Okay, that's it. And after that, now Miss uh, driver, okay. Okay. Uh, do you want to mention any kind of drug history? You told me that you took just paracetamol and the syrup and some ointment. That's it, right? Am I right with that?
Yes.
Okay. Other concern that you want to know anything
I
else?
just want to know what's happening with me.
Okay,
I
okay.
just
I
want
really,
to
yeah,
know,
I
is
I
it
know
a
you.
cancer or not?
Okay, I know you are so worried. It's a matter of worry. I appreciate it, and I really feel for you. Okay, let me tell you that the cause of your swallowing problems, you know, could be due to acid related problem. We have some acid in our food pipe, which help in food digestion, uh, or this is the it will be a range of problems. So it could be like this, or as you have some weight loss, not some weight loss, you have uh, 8 kg weight loss in 2 months,
Hmm.
which is as far I'm concerned, it is not good. Okay, so you're
What do you
swallowing.
mean by it's not good? That means what happened to me?
Okay, I am trying to explain you. Don't worry. Let me tell you. We are not, sure of any diagnosis. For that, we need to do some investigation. But let me explain you. As you you are 66-year old, and you are having difficulty in swallowing, and you have a gross weight loss. Okay,
Hmm.
so it could be, there's a chance of that it could be cancer. Okay.
Oh my God. So are you
Okay.
telling me I have the cancer? I don't
No.
think so. I don't
Okay.
think so.
Okay. Take your time. Calm
Because
down.
no, because no, because of my one of the relative, he had the cancer. He had the lots of the bleeding that coming through the mouth, even also from the stool. I don't have this the kind of the symptoms.
Okay. I can feel you, Mrs. Driver, and I'm really sorry for this. Hard day and hard informations. It's really hard for you. I can feel you, but let me tell you that it's a probability. It's a possibility. I'm not saying that you are having a cancer. Okay, it's a possibility, and it's the worst possibility. Okay, I'm not saying that you are suffering from cancer, but I am just letting you know that you could, prepare yourself. Okay, that's
No,
it.
it can be cancer. No, no, doctor, it can be the cancer. I have my disabled husband. I have to take care of him. So it can be the cancer. And everything will be the disaster. It can be.
Okay, I really understand that you have lots of responsibility regarding your husband and your household and your social, work. I really feel for you, and you know, I'm just saying that it is a possibility, okay? Uh, According your symptoms, what you have told me, I'm not assuring you, okay? So you can take your time and we can go through some investigation. Then we can finally come to a diagnosis.
Okay, so what kind of the investigation and I have to do?
Okay, let me tell you. At first, we will do some, blood tests and chest X-ray. And as you have some symptoms which is concerning, so we need to do an outpatient endoscopy. Okay.
What is
Within
endoscopy?
Okay, let me tell you, don't bother about the term. It is, just to see through your gullet or your food pipe to see whether there is any lesion and what is the, you know, type of that lesion. We will,
So this is
diagnose.
one kind of the camera test. The camera test I have to I have there is some the camera containing the food some pipe inserted through my mouth to see my food pipe or stomach.
Yeah, you are absolutely right. It's a
No,
camera.
this no, I'm absolutely disagree with you. This is the kind of the procedure. It shouldn't be the happen with me. Oh, the way then for the what my the husband will do if I admit in the hospital. This is not the simple the procedure. Already know about that.
Okay,
Can you
okay.
do some the other the CT scan of my abdomen over the stomach to see what actually happened? Why did you do the something is very the complicated things to me?
Okay, Mrs. Driver, please come down. I really feel you. I really feel you. Just don't worry, okay? Don't get bothered with that term and just don't think deep about that procedure. Let me tell you, let me explain you what is that. And at first, let me assure you that you don't need to admit in hospital, okay? We will do it in an outpatient basis. Just you have to, it will be a day-to-day procedure and it will just take 5 to 10 minutes. Okay, so you don't need to worry that you have to get admitted. And I'm really know that you are a very you're a person with lots of responsibility. I really can feel you, and I can feel your husband too. Okay, and in that case, we will also provide a multidisciplinary team or a social, a team that social worker team who can take care of that for that out that that hours for that time
So
period for you.
what's wrong with why did you do some complicated? I don't know. So camera that tested by don't I get the pain the
Yeah.
while this the pipe is inserted to my mouth?
Okay. Yeah, yeah. Whatever you said that I can go through a CT scan, yeah, I can. But the type and the nature of your lesion would not be diagnosed through the CT scan. Okay. I know it is non-invasive, it will be easier, but let me tell you, endoscopy is a procedure, and I mean, this camera test is a procedure that will take just 5 to 10 minutes. And if you can just, in fact, talk about your concern with the, doctor who will go through this procedure, who will do this procedure, and not only that, it can be done without sedation or with sedation, which whichever is you are comfortable with. So you don't need to be worried that you're thinking that it will be a very complicated procedure, but I can assure you that it is not a complicated procedure. It is just a procedure that will help us to confirm and to know the actual condition, actual type of your
Yes, yes.
type and nature of your lesion. It will help us further, and it will help us to go through a confirmed diagnosis. Okay, that's why it's important for you, and it is
So
not
the when I have to do that test.
okay. Okay, you have to do that within 2 weeks, as you have some symptoms which are important, regarding the diagnosis.
Okay, then arrange this the things as early as
Sure.
possible.
Sure,
This
sure.
need to be sorted out. I'm really right now. I mean, I'm very anxious.
Sure, Mrs. Driver. Just don't worry. It might cause you a just simple sore throat, or little bit bleeding, or nothing else. And in rare and rarest thing that can happen, that is perforation. You don't need to think about that. Okay, because it is a rarest complication. It doesn't
So
happen.
who will do the camera the test? They are not the expert. They didn't the, this the procedure as it before.
Yeah, they are the expert. They are the
So the
expert.
complication. So the complication that shouldn't be the happen,
Yeah,
isn't it?
yeah, definitely the complications will not happen. We will hope for the best. But as it is a procedure, you should inform me, right? What can happen? You told me at the
Okay.
beginning that you want to know the worst what can happen. That's why I'm saying
Okay.
this. Okay, you don't need to worry, and we will arrange this camera test within 2 weeks, and I will confirm the date and time just before you leave
Okay.
the hospital.
Okay.
And the management plan is actually dependent kind of all max depends on the test report of that camera test. Okay, camera test. So
Okay.
uh, I really if there is nothing that much concerning, then we will just prescribe you some kind of medications, which will help you with your acid acid formation. Or
So you're going to treat me, or I have to. You have to refer me the bowel doctor, stomach
okay,
doctor.
yeah, and just don't worry. I will be here as we will definitely refer you to a stomach and stomach doctor who will be specialist on this matter, and he will definitely help you out, and give a
Okay.
proper management plan. Don't worry, I am really sorry, it's a hard day for you, but it will be more comfortable. Okay, don't
Okay.
worry.
Okay.
Okay. Do you want me to summary the discussion what we have gone through?
Already I got it that I have the problem over my swallowing, and that's why I have to do some of the test to see that what actually happening inside of my food pie,
Yeah, yeah,
isn't it?
yeah. That's it. And you don't need to worry much about the the camera test. Okay, ma'am.
Okay.
Okay,
Okay.
thank you. And if you have any queries, just let me know. I will provide you my contact number and the hospital's contact number. And in fact, I will provide you brochures regarding the imaging test. You will just go through that when you are at home, so you will be more, aware of it. So it will be comfortable for you more. Okay, I
Okay.
hope. Okay, yeah, I
Okay.
best of luck. Okay, thank you.
আচ্ছা।
থ্যাংক ইউ দুজনকে। ব্যাপক বড় টপিক এটা।
বলেন।
আচ্ছা, প্র্যাকটিস সাবিয়াপুর ইয়েগুলো ভালো ছিল, টোন এবং ক্রস কোশ্চেনের প্রসিডিউর গুলা, কনসার্ন গুলো। আচ্ছা,
সাবিয়া আপু, যেগুলো মিস করছে এগুলো একটু বলেন না।
আচ্ছা, না মোটামুটি আপনি সবকিছুই ধরতে পারছেন, সমস্যা নাই। তো ওইটার মধ্যে একটু বলতে হবে যে পেইনফুল থ্রট সোয়েলিং আছে কিনা, পেইন হয় কিনা, মানে অডেন্টোফেজিয়া যেটাকে বলে। আর যেখানে ডায়াবেটিস বসছে, ইনক্লুডিং ওই যে আগের কথায় যে 3 মান্থ ডায়াবেটিক কেমন, তো এবার ভিজিট ডায়াবেটিক ডক্টর রেগুলারলি, এটা মানে ডায়াবেটিস আন্ডার কন্ট্রোল আছে নাকি নাই, এটা একটা কথা। আর যেহেতু সে একবার ডায়াবেটিস বলছে, যদিও তার ওয়েট লস আমরা বুঝতে পারতেছি যে একটা ম্যালিগনেন্সি, তারপরেও আপনি অলরেডি মাউস সোরের কথা আস্ক করছেন, আবার এক্সামিনেশনে দেখছেন ওই যে ওরাল ক্যারিয়াসিস ওয়ান অফ দ্য রিজন হতে পারে আর কি, আপনি এটা আস্ক করছেন। এটা একটা হচ্ছে এটা হচ্ছে একটা কথা। এই তো। আর হচ্ছে কি এই যে আমার মেইন কনসার্ন হচ্ছে কি হচ্ছে ডিসপ্যাজিয়া কেন হয়েছে ওইটা আমার মেইন কনসার্ন। দেন হচ্ছে যে আমরা হচ্ছে যদি হচ্ছে মাথায় হচ্ছে রাখি পরে আমাদের পয়েন্ট গুলা কি পাস্ট মেডিকেল হিস্ট্রি, মেডিকেশন হিস্ট্রি, সোশ্যাল হিস্ট্রি, ফ্যামিলি হিস্ট্রি, এগুলো হচ্ছে কি আমরা এক কথায় হচ্ছে আক্স করে ফেলবো, অত বেশি না। যদি বলে পেশেন্ট হচ্ছে স্মোকিং, আচ্ছা ঠিক আছে আপনার আমি স্মোকিং সাজেশনে হচ্ছে পাঠিয়ে দিচ্ছি। আচ্ছা অ্যালকোহল সোশ্যাল লিমিট নাকি, আচ্ছা ঠিক আছে মুভ অন করতে হবে। আর এই কোশ্চেন গুলো যেহেতু আমরা তো এখন অনলাইনে করতেছি, আমরা তো আর সামনাসামনি আর এক্সামিনেশন করতেছি না, এই ছোট কোশ্চেন গুলা আমরা হচ্ছে যখন এক্সামিনেশন করব ডিউরিং দ্য টাইম হচ্ছে আক্স করে হচ্ছে ফেলবো, যাতে আমার সময়টা নষ্ট না হচ্ছে হয়। এমনি হচ্ছে বলে যে হচ্ছে 2-3 মিনিট হচ্ছে পেশেন্টের সাথে কনভারসেশনে যাওয়ার পরেই হচ্ছে এক্সামিনেশনে চলে যাওয়া। ইন দ্য মিন টাইম হচ্ছে আমার এই লেস ইম্পর্টেন্ট কোশ্চেন গুলো আক্স করে হচ্ছে ফেলা।
আচ্ছা।
আদারওয়াইজ হচ্ছে ভালো আছে ওই যে যখন আমি থ্রো আপ কথা বলছি যে আমার বমি হয়, ওইটার হচ্ছে কন্টেন্ট গুলা হচ্ছে কি, খাওয়ার কতক্ষণ পর, আবার ব্লিডিং আছে কিনা সাথে, হোয়াট দ্য কালার, এটা হচ্ছে একটু আক্স হচ্ছে করতে হবে এটাই। আর
ওকে
হচ্ছে
আপু।
কোনো জার্গন না, এন্ডোস্কোপি না, আমরা ক্যামেরা টেস্টের হচ্ছে কথাই বলবো। আর আপনি ওইগুলো আমার যে কনসার্ন গুলো ওইগুলো আপনি একদম পারফেক্টলি অ্যান্সার হচ্ছে দিচ্ছেন যে কেন আমি সিটি স্ক্যান করবো না। কারণ হচ্ছে কি আমার হচ্ছে ফুড পাইপ থেকে হচ্ছে আমি ভিজুয়াল ডিরেক্টলি ভিজুয়ালাইজড করতে পারবো। আর আমার যদি ওইখান থেকে বায়োপসি নিতে হয় দেন হচ্ছে আমি এটা নিতে পারবো। হোয়াট আই ক্যান ডু ইন সিটি স্ক্যান অফ দ্য অ্যাবডোমেন, এটা আমরা হচ্ছে যেটাতে আমরা পারবো না। এটা হচ্ছে মেইন হচ্ছে আর কি কথা। আর হচ্ছে ওই যে আপনি স্ক্লেরোডার্মা ওইগুলো আক্স করে নিছেন। ইভেন হচ্ছে আমার নিউরোলজিক্যাল প্রবলেম আছে কিনা, যে নেজাল দিয়েও হচ্ছে আমার ফুড ইয়া বমি বের হয়ে যাচ্ছে কিনা, এটাও আক্স করছেন। হ্যাঁ এটা ঠিক আছে। হ্যাঁ ডিসফেসের ওয়ান অফ দ্য কজ, এটাও একটা আক্স হচ্ছে করতে হবে। ইভেন ডার্মাটোমায়োসাইটিস পলিমায়োসাইটিস হচ্ছে এইভাবে হচ্ছে নিয়ে আসতে পারে, হয়তোবা তার ম্যালিগনেন্সি আছে, সেই কারণ হচ্ছে ডার্মাটোমায়োসাইটিস ডেভেলপ হচ্ছে করছে, এটাও একটা হচ্ছে কারণ হতে পারে। উইকনেস এর কথা জিজ্ঞেস করছেন, বাট মোর দ্য স্পেসিফিক্যালি দ্যাট আই ক্যান গেটিং আপ ফ্রম মাই চেয়ার and climbing the art during the stair, যদিও এখানে এটা মেনশন করা নাই, এগুলো একটু হচ্ছে মেনশন করতে হবে। ডিসফেজিয়া নট অনলি জিআইটি, নিউরোলজিক্যাল কেসও হচ্ছে ডিসফেজিয়াতে আসতে পারে। এই তো। আদারওয়াইজ হচ্ছে আপনি আমার কনসার্ন গুলো সুন্দর হচ্ছে এ করছেন আর কি। আর আমরা আরেকটু টাইম ম্যানেজমেন্টের দিকে আমাদের খেয়াল রাখতে হবে। এগুলো তো 15 মিনিট মোস্ট প্রবাবলি স্টেশন, আমরা যাতে হচ্ছে আরেকটু তাড়াতাড়ি 20 মিনিটস এর মধ্যে যাতে আমরা শেষ করতে পারি আর কি।
ওকে, হ্যাঁ একটু স্পেসিফিক করে ফেললে ভালো, মানে যেগুলো মানে একদম ইনিশিয়াল চিফ কমপ্লেন রিলেটেড কোশ্চেন গুলো র্যাপিডলি আস্ক করে ফেলতে হবে ইনিশিয়ালি, তাহলে।
হ্যাঁ আমাকে মানে তাড়াতাড়ি ক্যাচ করে আমার অন্যদিকে হচ্ছে ইয়ে করতে হবে।
ওকে।
আর হচ্ছে পরে শেষের দিকে বলতে হবে যে আপনাকে আমরা হচ্ছে পাঠাই দিচ্ছি দ্য বাউল ডক্টরের হচ্ছে কাছে। বাট অ্যাজ দ্য পেশেন্ট বাউল ডক্টরের কাছে পাঠালে কিন্তু সময় আছে, যে কালকে দেখাতে পারে এমন না, ওদের প্রসিডিউর মেনটেন করে এমনও আছে 2-3 মাস লেগে যেতে পারে। তো এর জন্য আমি ওয়েট না করে আমি নিজেই ক্যামেরা টেস্ট হচ্ছে করে ফেলতেছি। বাট আমি হচ্ছে বাউল ডক্টর, অ্যালং উইথ দ্যাট অ্যাজ দ্য ওর হচ্ছে হাজবেন্ডকে কেয়ার করতে হয়, সোশ্যাল হচ্ছে ওয়ার্কার, আর অ্যালং উইথ দ্যাট দ্য ক্লিনিক্যাল, যে ক্যান্সার পেশেন্ট গুলো সাসপেক্টেড তো ক্লিনিক্যাল নার্স দ্য স্পেশালিস্ট, যাতে হচ্ছে ওর হচ্ছে অন্যান্য যে হচ্ছে সোশ্যাল অ্যাক্টিভিটি এগুলো যাতে মেনটেন হয়, আমরা ওদের কাছে রেফার করে দেবো।
ওকে, আর কিছু?
আর আরেকটা হচ্ছে যে ফিনান্সিয়ালি হচ্ছে আমি সাপোর্টেড কিনা, যেহেতু আমার হাজবেন্ড তো ডিসেবল, আমারও এদিকে অবস্থা, তো এটা কোনো সাপোর্টের লাগবে কিনা
হুম।
এটাই। আর যে কোনো হচ্ছে প্রসিডিউর যখন পেশেন্ট হচ্ছে কনসার্ন হচ্ছে থাকবে, তখন তারা বলতে হবে কি যে আমরা যে হচ্ছে আওয়ার টিম who will do the camera the test, they are the expert, they are the very expert, they did this the test as many as before. So I can assure you that this the camera the test that will be the more painless as much as we can help you, এটা হচ্ছে বলে হচ্ছে নিতে হবে।
এটা এটা ভালো বলছেন, পেইনলেস, এটা একটা বলতে হবে, হ্যাঁ।
হ্যাঁ যদি সে আবার বলে যদি না আমার ফ্রেন্ড করছে এটা পেইনফুল ছিল, বলছে
হুম,
যে না এটা তো অ্যাকচুয়ালি হচ্ছে আই ডোন্ট নো হোয়াট অ্যাকচুয়ালি দ্য সিচুয়েশন অফ ইয়োর দ্য ফ্রেন্ড, বাট ক্যামেরা দ্য টেস্ট ইজ অলমোস্ট দ্য পেইনলেস অ্যাজ উই, যে আপু যেটা বললো যে আমরা সিটেশন বা অথবা স্প্রে হচ্ছে করে হচ্ছে নেই। সো ইট উইল বি দ্য টেক দ্য অনলি দ্য 10 to the 15 মিনিট, অ্যান্ড there is not the much the side effect, but still there is a rare the side effect and the occur. Yes, you have the kind of the thought of the pain, but for a while, not for a while, just after camera the test, it will be go on by itself. এভাবে বলে ইয়ে করতে হবে আর কি।
ওকে, আর তাহলে কি ইস্যু আছে এখানে? সোয়ালিং রিলেটেড পেইনফুল তো বললেন।
ক্রস এক্সামিনেশনে যখন এক্সামিনেশন এক্সামিনেশন হচ্ছে আমরা যেগুলো বলবো।
হুম, আরটা হচ্ছে ওই যে আপুর ওই যে ক্যামেরা টেস্ট করতে হবে, এই কথাটা বলতে হবে, এন্ডোস্কোপি না। হ্যাঁ, আর
হ্যাঁ মানে
পাইপ, গার্ড পাইপ দেখবো।
হুম,
ওকে, সবই বলছে অবশ্য। আচ্ছা, আমাদের সাথে কান্তা আপু আছে। ওকে, আর কিছু বলবেন নাজিয়া আপু এখানে?
না ভাইয়া, ঠিক আছে, আপু আমাকে ধরাই দিছে, আপু থ্যাংক ইউ।
হুম।
আচ্ছা।
আরেকটা হচ্ছে আমাদের আসলে ইনিশিয়েশন গুলো খুব একটা
আপু
ভালো হয় না।
একটু আরেকটা কোশ্চেন, পারেক্টাল এক্সামিনেশন যেটা, ওটা কি
হ্যাঁ,
এখানে করার দরকার আছে?
মানে এটা আমি না নিজেও হচ্ছে কনফিউজড, আমি উত্তরটা দিতে পারতেছি না। আমি হচ্ছে কনফিউজড অ্যাজ দ্য পাওয়ার অ্যাকচুয়ালি হচ্ছে
ওরা
খুব কিছু হচ্ছে নাই। হুম,
ওরা
জি
কি
ভাইয়া
ডিআর
বলেন।
কথা বলছে? ওরা কি ডিআর এর কথা বলছে এক্সামিনেশন?
হ্যাঁ ওরা বলছে।
মানে ওই যে অ্যাবডোমেন রিলেটেড, তো এই জন্য মানে মনে হয় পার্ট অফ এক্সাম।
আচ্ছা।
তাহলে করতে হবে, মানে বলতে হবে আর কি at least। আর যেহেতু ক্যান্সার সাসপেক্ট করতেছি, করা যেতে পারে। হুম। আচ্ছা, নেক্সট তাহলে আমরা ডায়রিয়া রিসেন্ট অ্যান্টিবায়োটিক্স এটাই রাখি।